I'm in charge of Project PACT, which is a NIDA-funded, couples-based HIV, STI risk reduction intervention for men on probation and their main sexual partners. PACT is Protect and Connect. It's an implementation study, which means that we already know that it's effective. We're just seeing if it's effective in the community.
The Connect Unite project is a part of the Social Intervention Group, which is housed at Columbia University School of Social Work. The sample that we're looking at now is 200 couples. The couples are predominantly black men and their same-sex partners. These men are stimulant involved, and that's what we're testing. We're taking that idea of being able to use the social intervention to determine whether or not we can reduce the incidence of new HIV infection and reduce self-reported substance use among black men and their same-sex partners.
Well, in terms of HIV, New York City is sort of like the epicenter in the United States. The Bronx is, I hate to say this, the third world country in New York City that everybody forgot about. The numbers in the Bronx are comparable to sub-Saharan Africa in terms of HIV.
We have tried a number of different techniques in terms of recruiting participants for the study. The one that we found most success with is recruiting in the community. So one of the things that we do, we go to pride festivals, we go to healthcare events, we go to various events thrown by community-based organizations, and we're able to talk about the research that we're doing and get people interested in the type of work we're doing up here at Columbia.
Our research can't exist without working hand in hand with the community. And our participants, even though this is a research center, they see us as a safe place that they can come, and get a hot cup of coffee and just check in. Even though what we do is sort of individual, we've seen people actually in the group setting become connected. We've had sessions where one woman had to thank the other woman because she was like, I was feeling really low last week and I was about to start using again, but I called, XYZ, and she was able to tell me, don't use, or let's go to a support group.
Research can really affect change. It's not really just about publishing an article that goes into a journal somewhere. There's a social justice piece to all of this that I find really interesting and important, that even though they're participants and they're collecting data, there's movement in terms of how people feel about themselves and their lives. And we really experience that when we go to Pride events and people come up to us and they say, oh, we miss coming into our sessions, or we really enjoyed ourselves, or we learned a lot. Or even giving folks hope in terms of how to deal with prejudice and discrimination in their community, how to sort of build coalition or find support services in their communities to combat homophobia or racism.